Hey guys, Dr. Tristan here. I am done for the day, done with my clinical work for the week. I'm going to be recording lots of content tonight and tomorrow. As you can see, I am very much in my gown, and I'm just driving to fetch a friend of mine. Guys, so I just got off a meeting with my financial planner and a PR agency, words that I didn't think I would ever say. So incredibly grateful, incredibly blessed, and everything in between that one could imagine. And please just keep liking the channel and subscribing and sharing and all of the positive comments. Thank you so much. It really is. It's so gratifying. My website is still under construction, www.Anesthesia tutorials. Remember, it's the British spelling, ANAES, but it'll be live soon, and subscriptions will be live from the 1st of August. All the information will be on all of the platforms and will be mailed to those of you that have subscribed up early, so that you can claim your early adopter bonus, which will be a 20% discount on the pricing for the content that I'm going to be offering. So guys, I thought while I'm driving here quickly, I should just do another one of my Dr. Tristan Explains to parents. And I'm going to take a step right back to the beginning, and I'm going to do an explanation to parents and to the public about general anesthesia versus regional anesthesia, and just kind of have a chat with you for a little bit about what anesthesia actually is. Okay, so I know a lot of people will say, oh, it's just a deep sleep. I obviously, when we talk colloquially, I will say, oh, I'm putting the patient to sleep, I'm waking them up, or we'll say I'm doping the patient or whatever. So I mean, it's understandable if one thinks that it's sleep. Some people think it's a version of sort of a coma. God forbid, I hope not. Some people say, oh, they die and you bring us back to life. I wish I was that good. If you die for a very short time, I can bring you back to life pretty well. If you die for an hour in theater, you're not coming back. No, so guys, it's not sleep. You're not dead. You're not in a coma. What is anesthesia? So anesthesia is an inducible, reversible loss of consciousness accompanied by an inability to feel pain, to move, or to form memories. So I'll say it again. Anesthesia, general anesthesia, refers to a condition that I, as an anesthetist, induce, okay? So it's an inducible but reversible loss of consciousness that's accompanied by no muscle movement, no forming of memories, no pain. And this is a state that can be induced in many ways. So if you think of an anesthetic as an airline trip, basically what that entails is that you have the takeoff, you have the cruising period, and you have the landing. And if you watch any air crash investigations or anything like that, you'll see obviously that most problems occur in takeoff or landing phases. That terrible, terrible Air India crash that happened most recently being one of them. And it's the same in anesthesia. So at the beginning of an anesthetic, if you are doing a general anesthetic, and remember that not every surgery is done with you asleep, with you under anesthesia. You see, we say the word asleep, it's just a colloquialism, so that you can understand. Imagine if your anesthetist, the first thing that they said to you was, hello ma'am, hello sir, my name is Dr. Tristan, and I'm going to be doing a general anesthetic for you, and that is an inducible, reversible loss of consciousness. You won't move, you won't form memories, you won't feel pain. You're going to go, oh my word, this sounds like the beginning of the Twilight Zone. So what happens at the beginning is I use some form of drug, of medication, of chemical, whatever word you want to use, to make you sleep. Okay, so to induce the state of general anesthesia. Now, the most common is what we call the milk of amnesia, which is propofol, and that is the most commonly used induction agent. Unfortunately, it's the one that Michael Jackson's doctor was giving him in his bedroom, and that's why he died. And it does burn a little bit on injection, but it's super safe. It works quickly. It's just a wonderful drug, and we'll talk about it when I do a pharmacology lecture. But I'm sure a lot of you that are parents have seen that there are other ways we induce anesthesia, and we do what's the so-called a gas induction. That gas being oxygen plus sevoflurane. So sevoflurane is what we call a volatile anesthetic. So remember, anything that's volatile means that it evaporates very rapidly. So it changes from one state to another very rapidly. So when I say sevo in the talks, we can use sevoflurane at a high dose and a high concentration. It takes anywhere from 5 breaths to a minute, and the child will then go to sleep. Your child will then go to sleep. The anesthesia will have been induced. But I'm sure what a lot of you parents might be thinking now is that, hey, my child, though, moved a lot and wiggled around in that as the mask was on and fought. And that doesn't happen when an adult gets propofol. And that's the reason why we prefer what we call an intravenous, an IV induction with propofol, because it's much more rapid, it's much more predictable, and you don't have this period during the gas induction with the sevoflurane where the person is very restless, confused, because they're going from a very awake plane to a very deep plane, but they're going through all the little steps in between. Whereas with propofol, it's as if we've cut the elevator shaft cable, and we are going straight from awake to asleep. And once we switch it off, we go from asleep to awake. Okay, so that's the first thing. That's induction of anesthesia. So we use gas or propofol, and in kids we use gas because most of the time we try not to traumatize them by putting up a drip beforehand. But we do put up a drip beforehand in children who are sick or who are coming for major surgery, because then we are erring on the side of safety and caution. So the next phase is the maintenance of anesthesia. Now that involves me monitoring the patient's heart rate, blood pressure, oxygen saturation, carbon dioxide concentration, their pain, their urine outputs, etc., and treating all of those and keeping those all normal, all right? And to maintain your anesthetic, we use gas, most commonly sevoflurane or desflurane mixed with oxygen and air, or if you have an allergy to the gases, in certain surgeries, you might need, you might not be allowed to have gases. Some people, it makes them very nauseous, etc. You will then be kept asleep with what is called a propofol TCI, and basically your maintenance is an infusion of the same drug we use to make you sleep. So we can either make you sleep with gas and keep you asleep with gas, or we make you sleep with propofol, keep you asleep with gas, or we do the double propofol where we make you sleep with propofol and keep you asleep with propofol. So we've made you or your child sleep. We've done the surgery. I've looked after them. They're stable. They're healthy, happy, no pain, etc. And I then need to end this procedure. We need to land this plane. That phase is called emergence from anesthesia. And this is the phase where, in my opinion, most issues take place. And we'll discuss common things that go wrong in another video. But in this instance, we do not actively wake someone up. We don't quite have that drug yet. It's a passive process. We switch off the gas and we increase the oxygen flow, and your child or you breathes out all of that gas. So whatever's got it in the brain that's been keeping you asleep filters out and you breathe it out. Or we switch off that propofol, and whatever's been left in your body gets metabolized, redistributed, etc., and you wake up passively on your own. So those are the 3 phases of an anesthetic, of a general anesthetic. It's induction, maintenance, and emergence. And just to remind you of that definition, folks and family, general anesthesia is an inducible, there was something on the road, is an inducible, reversible loss of consciousness that is accompanied by the inability to form memories, the inability to move, and the inability to feel pain. So I hope you found this one helpful, guys. I certainly did, and please keep liking and subscribing and sharing.